Good morning. Welcome. Welcome to all of you who are somewhere far away or near to us through this internet system that has made our life possible in spite of the COVID crisis. I'm Matti Apra, a medical oncologist, and I'm the president until the end of this year of the European Cancer Organization, joined for this session by many colleagues from the European Cancer Organization, by also members of the Parliament and representatives of the DG Santé, and specifically by Stella Kyriakides, the Commissioner for Health and Food. It's my pleasure to welcome you all, and especially to ask you to participate. By using the chat box that you can see there on your screen. Please send us all your comments, your questions, share any feedback you would like to have, and also indicate to us either the chat box or by coming to the website that you would like to get involved in the Time to Act campaign in your country in order to increase the impact of what we are doing right now at the European level. The event is going to be recorded and will be available on our website. Don't let COVID-19 stop you from tackling cancer. You'll see this in different languages very soon. The European Cancer Organization that is launching this campaign is a federation of 34 professional societies, and 20 patient advocacy groups are helping us to work together to build consensus and through this achieve improvements in cancer care. We need also your help, of all of you out there, in order to go ahead with this and many other campaigns that are needed in the cancer area. We have been working over the last 2.5 years through focused topic networks, looking at the different moments in which the patient has an itinerary of cancer particular stop. And of course, we start by prevention, hoping that no one will get cancer. But unfortunately, people do get cancer. And there are many areas in which we are working. They are here on the slide. They are on our website. Please visit our website. Please offer your help. And now we are going to discuss about COVID-19 and cancer. We have built a 7-point plan, which is available on our website. And this is the basis of the campaign that we are going to launch today with all of you. We have all realized that there is a backlog. There's a backlog in cancer diagnosis and cancer treatment. This is also true for many other very difficult diseases like cardiac issues, like diabetes, but we are the cancer organization. That's why we are talking about cancer. We need to restore the confidence of the citizens who don't understand in many countries anymore what is really going on. Can they, cannot they, what can they do? We need to have a clear message. We have to work on avoiding the shortages that happened and that might happen again if there's another issue. And we have to work together using all the technologies that are made available to us, which are absolutely fantastic, in a proper and appropriate way so that we can improve the quality of care for all patients throughout all of Europe. And we have to have data to support us on this campaign and on other work in the fight against cancer through a much better pan-European health cooperation. The one until today has been good, but we can certainly improve a lot in order to make it true that cancer will not become the forgotten sea in the fight against COVID-19. I would like to thank all the supporters of this campaign. Of course, all the societies of European Cancer Organization, the patient advocacy groups, and the members of the Community 365, the industry, and many foundations that have been helping us to work and to launch this campaign, which is going to be today, tomorrow, next month, until we have visited hopefully every European country. And it is now my pleasure and great honor to introduce the Commissioner for Health and Food, my Stella, the floor is yours.
Cancer takes time away from us, our family and friends. It doesn't care who or where we are. And it will not wait for the COVID-19 pandemic to be over. But together, we can act to make a difference. For each of us, that starts with prevention and early diagnosis. They offer the best chance of keeping cancer at bay. So please, don't wait either. Don't waste time. Time is your friend. If you act quickly enough to detect and prevent. Visit your doctor if you're worried you may have cancer. Go for your checkup. Do your screening early. Follow treatment if you're asked to. Your health services will do all they can to keep you safe. Meanwhile, at the EU, we insist that it is time to act, and we're doing all we can to reverse the cancer trend in Europe. We have put a Beating Cancer plan in place that focuses on patient needs, from prevention to survivorship. It is a plan for all Europeans. We can all make it a success and call time on cancer. It's time to act, for all of us, to act together. To find out how, go to timetoactcancer.com. Thank you.
Thank you very much, Stella. Without your support and the support of the wonderful team you have around you, we would not go anywhere. We need you, but we are here to help you and your team, and everyone that is listening to us, looking at us, is certainly here ready to support all your efforts. We'll be joined later by MEPs and by Sandra Galina, Director General of DG Santé. And for the time being, I would really like to ask you to use the chat, put in your questions, put in your comments, and also remember, tell us if you can help us in your various countries. And now my pleasure is to introduce the two co-chairs of our special COVID-19 network, Miriam Krul and Mark Lawler. Mark, the floor is yours.
Thank you very much, Matty. My name is Mark Lawler. I'm Professor of Digital Health at Queen's University Belfast, and I have the honour to be co-chair of the European Cancer Organisation's Special Network on COVID-19. For me, COVID-19 is personal. My uncle died of a COVID-19 related illness on the 29th of March 2020. And one of my colleagues, Edward Vidoliak, an oncologist from Croatia, while reaching out to me to sympathize with me on my loss, said this very chilling words. People are starting to fear a COVID-19 diagnosis worse than a cancer diagnosis. That really worried me. But we looked to see, was there any data out there to either support or refute this statement? And we found that there wasn't. So this journey started with us looking to find data, to find cancer intelligence that would tell us about the impact of COVID-19 on cancer. And this led, as Matty said, to the development of our 7-point plan to address the urgency and build back better and smarter from COVID-19. And we now know through a number of reports from the IQVIA Institute, but even yesterday from Becca in relation to their consultation in relation to COVID-19. So we know the impact of COVID-19 on cancer, but it is critically important that we continue to gather cancer intelligence that informs where we go in relation to not only identifying the problem, but also most importantly, addressing it, mitigating it, so that it no longer becomes the situation that cancer patients and members of the public fear a COVID-19 diagnosis worse than cancer. In this regard, we have developed a number of different approaches that really look very precisely right across Europe at what the impact is And this data has really driven our policy response. So we've looked at 6 different areas in relation to the impact on cancer patients, on cancer diagnosis, on cancer treatment, but also on the cancer workforce, on cancer screening, and also on cancer patient screens. And the data that we have produced is quite worrying. What we found is the following. The impact of COVID-19 since the pandemic started has been that clinicians in Europe have seen 1.5 million fewer cancer patients in this first year of the pandemic. Similarly, 100 million, yes, that's not a misprint, 100 million cancer screening tests have not been performed in Europe as a result of the pandemic. Added to this data, we also find that we have had significant impacts in relation to cancer diagnosis. 1 million cancer patients across Europe may be undiagnosed due to that backlog that I described in relation to screening tests, but also due to reduction and delays in referrals and restricted healthcare resources that have happened due to the COVID-19 pandemic. So that means that there are 1 million Europeans out there who don't know that they actually have cancer. We also saw significant evidence of an impact on cancer treatment. 1 in 2 cancer patients in Europe did not receive the surgical or chemotherapy treatment that they needed at the right time. And for 1 in 5, there are still significant delays. Not only has there been an impact on cancer patients and on European citizens, but also on the cancer workforce. The pandemic has unfortunately taken its toll on healthcare workers. 4 out of 10 are feeling burnout. 3 out of 10 are showing signs of clinical depression. And also, because of the fear that I mentioned already in relation to contracting COVID-19, both European citizens and cancer patients are not going to their GPs to either highlight symptoms that may lead to cancer or for screening appointments or appointments for their treatment. These data are extremely worrying because they reflect cancer intelligence that is telling us the disastrous impact that COVID-19 has had both on cancer services and also cancer patients in Europe.
Thank you very much, Mark. These are the data that we were fearing. They are there. It's time to act. Miriam, now it's your turn to discuss with us. The floor is yours.
Martin. My name is Miriam Krul and I work as a hospital pharmacist in Amsterdam in the Netherlands. And it's a great honor to share with you this campaign that we're launching today in 30 languages. We will first show you the campaign video.
COVID-19 has disrupted our lives and had major consequences for cancer care and cancer patients. While we may be waiting for the pandemic to end, cancer won't wait. So it's time to act. Taking care of your health and keeping cancer in check is as important as ever. Don't let COVID-19 stop you from going for regular screenings or treatments. The earlier the diagnosis, the better chance of treating cancer. A visit to your doctor could be life-saving. Are you bleeding when you go to the toilet? Do you have a lump in your breast? Difficulty swallowing? Unexpected weight loss or other warning signs? Don't wait. Contact your doctor. Don't delay your appointments and don't hesitate to plan new ones. Make sure that you go if you are called for a screening appointment, HPV vaccination or ongoing treatment. Because cancer won't wait, neither should you. Health services continue in the safest conditions to provide you with the care you need. It's time to act before it's too late. Don't let COVID-19 stop you from tackling cancer.
Please get involved with us. In our campaign, we have 3 distinct target audiences. First and foremost, of course, our cancer patients. We want to reassure them, we want to support them, and naturally, as we've heard, there might be over 1 million, up to 1 million citizens who are also cancer patients, but they don't know it yet. And therefore, we also target the general public. We want to tell them that it is safe to go to their healthcare worker and when to contact them. Of course, we also target the healthcare professionals. We want to let them know that they're not alone, and we want to enable them all to share their experiences and their best practices. And the third, and also very important target audience, are the policymakers. We need to catch up on this backlog, and we need the support from our politicians to do so, because we have to increase our capacity if we want to go back on track in providing our cancer care. On this next slide, you can see the campaign website. Each icon is a portal to more information. We have good visuals with the cancer warning signs, because we want to tell the public when it's time to contact, for example, their GP. I welcome you to visit our website, of course, and then if you do, please also look under the icon Time to Act with Unity. This has testimonials of people who are sharing their experiences or supporting our cause, and we already have very esteemed people there that I would like to thank. Many thanks to these MEPs. So today is the European launch, but we will make sure that we leave no one behind. And therefore, these messages have been translated in 30 languages, as you can see here. And it will not stop today after this launch. We will also have national launches. We will start in Poland, and also Italy, Romania, and Spain are scheduled. These national launches are done in collaboration with local politicians, local patient advocacy groups, and local healthcare workers. And they are, of course, in the national language. If you would like to get involved in a national launch, please feel free to contact us. Back to Matti.
Thank you very much, Miriam. And as you said, everyone, please join us in this campaign, Time to Act. Thank you to Mark also. Thank you to all the members of your special committee. And thank you for all the supporters that have helped us to start this campaign and also with the work of the committee. It is now my honor and pleasure to thank the European Parliament and especially the Beating Cancer Plan Committee, the special committee, and we have the great pleasure of having Bartosz Arlukowicz telling us a few words about his vision, the vision of the committee on our work. And yesterday in this live session at the Parliament, he introduced already the fact that he and his team are great supporters of this work. So Bartosz, we are looking forward to listening to you.
Dear colleagues, dear friends, over 3 million people died of COVID last year. The death toll that hits us every day means tragedies for many families. However, behind this number are also unplanned victims of other illnesses. People who did not get their diagnosis on time and weren't tested because they were afraid of getting infected. I'm glad that today, finally, we are talking about them. It is hard to estimate the impact of COVID on cancer patients, but we know that any delays in diagnosing, detecting and treating can be crucial if the patient has a chance to survive or not. That is why I welcome the initiative of ECHO and fully support the 7-point plan which involves the problem of delays in cancer treatment. We should promote prevention and screening programs. We should encourage people to get tested and have confidence in their doctors. I also support the call to address the shortage of the medical workforce. We should establish a common mechanism of buying the most needed medicines, including oncological ones, together as a union. Only this way can we prepare ourselves for the future crisis. Let's learn from the pandemic and organize ourselves better to treat our patients. They are counting on us, and we must help them.
And now it's my pleasure to turn to an entity that is so important for the whole world, the World Health Organization, and its ambassador for Europe, Aaron Anderson. Aaron, the floor is yours.
Thank you so much, Maddie. My name is Aaron Anderson, and I'm the new WHO ambassador for cancer in Europe. And I don't work in this field that all of you others do. Like I travel the world normally, and I work as an adventurer. I climb mountains, and I have a little bit of a different story compared to many of you. But what brings me here is that I had a pretty different childhood, and I climb mountains today as an adventurer in a wheelchair. And as a kid, I was diagnosed with a rare form of sarcoma in my lower back. I went through a really, really tough time, and somehow I made it. But if any one of you would have told me 25 years ago, when I was sitting here in the hospital, 9 years old, getting chemotherapy for cancer, if anybody of you would have told me, Aaron, in 25 years' time, you're going to be traveling the world, you're going to be doing adventures, you're going to be following your dreams. If any one of you ever would have told me that, I would never, ever, ever have believed you. Not a chance. Many kids that go through what I went through as a kid, they're not as lucky. They're not as lucky as I was. Why was I the lucky one? I have no idea. But I know one thing, and that is that I was given a second chance at life. And a lot of kids and a lot of people are not given that second chance. And I'm going to talk a little bit about that today. And a few years back, I met a wonderful girl. Her name was Saga. Here she is. There she is on the left. It's just such an amazing girl, full with energy, full with life. But what you can't see in this picture is that she's got cancer. She's got a similar kind of cancer that I had as a kid. She's got sarcoma in her lower back. And the big difference between me and Saga was when the cancer was detected. My cancer was detected after about 1 month of symptoms. For Saga, it was about 1 year, a little bit more than 1 year. The doctors wouldn't, for some reason, take her seriously. It's just this teenage pain, right? It will go away. We'll get better soon. It's just in your head. And that made an incredible difference. I was the lucky one. I was the one who's living my dream life today, traveling the world, going to places like this. And this is one of the last pictures I have of me and Saga together. It's outside of the palliative care unit here in Sweden, where I live. And she wasn't one of the lucky ones. And this was pre-COVID. This was before the pandemic hit. And this was in Sweden, one of the countries in the world with the best healthcare. And what I'm trying to say today is it's really time to act, as this campaign says. It's really time to act so we can save more lives. I mean, COVID is horrible, but at the same time, we can't forget cancer in this equation. And just seeing the statistics being presented here by Mark, I mean, we see how many people right now are not being screened. We see how many people right now who's got cancer, but they have no clue they got it. And if we can just act right now and find those people, we can be given a second chance and be more lucky than Saga was. Because no human, no adult, no child should die of cancer because there is a pandemic in society. So please act right now. And as an ambassador for the WHO, I really can't emphasize this enough. It's time to act now, and it's time to, go to your hospital. If you feel anything, go to the screenings. Don't forget this. It's so important. Thank you very much, and thank you to you, European Cancer Organization, for this initiative, and I fully support you. Thank you so much.
Aaron. I had a connection issue. Apologies for this. And we now will continue with the part that is going to be led by our patient representative at this meeting, and also a member of the Executive Committee of the European Cancer Organization, Kathy Oliver. Kathy, the floor is yours.
Thank you very much, Matty, and good morning, everybody. My name is Kathy Oliver, and I'm the co-chair of the European Cancer Organization's Patient Advisory Committee, and I'm also a director of the International Brain Tumor Alliance. So as we build back better and build back smarter, we must also remember that there are certain key rights which every cancer patient should expect from their healthcare system. And as many countries begin to emerge from lockdowns, cancer patients' rights are more important than ever. So it's time that we again acknowledge these rights, and it's time to honor them and act on them. The 10 key rights of the European Code of Cancer Practice highlight the importance of equal access to affordable and optimal cancer care. They highlight the provision of expert medical support and good quality information about an individual patient's disease and treatment. And here we have specialized multidisciplinary cancer care teams, shared decision-making, research and innovation, quality of life, supportive and palliative care, survivorship and rehabilitation. All of these are emphasized in the code. Now, the code has been co-produced by a team of cancer patients, patient advocates, and cancer professionals. It bridges the gap between clinical guidelines, healthcare policies, and patients' everyday experience. And as you can see from this slide, the code is now available in 25 different languages. And we're very grateful to all of our contributors to those translations. Now, the code is all about empowering patients and their loved ones, of course, to ask the right questions about their treatment and their care. And each of the 10 rights in the code is linked to 3 questions that a patient might choose to ask their healthcare professionals. And here on this slide is an example of this. Each right is also supported by a short explanation and by a review, indicating the best available medical literature, evidence-based guidelines, and research upon which that particular recommendation of the code is based. Now, I think it's important to say here that we're mindful, very mindful, that in some countries, some of the rights in the code may not be attainable right now. But the code can also provide an aspirational ideal and framework for improving healthcare systems and reducing inequalities. The code team, led by Professors Peter Selby and Mark Lawler, has just had published in the Journal of Cancer Policy a major medical literature and evidence review, which supports the European Code of Cancer Practice. This paper will tell you everything you need to know about the code. We think it will be a major tool in helping us all to build back better and stronger. Now, there's no doubt about it, as you've heard here today. COVID-19 has been like an earthquake ripping around the world, causing seismic suffering, death, and devastation. And the aftershocks have certainly been felt by cancer patients. Equal access to affordable and optimal cancer care has been reduced. Contact time with healthcare professionals has been curtailed. The cancer-related experience of loneliness and isolation has increased. The conduct of clinical trials has also been limited. And as you've heard here previously this morning, the data tells us that up to 1 million cancer cases could now have gone undiagnosed in Europe because of the pandemic. Now, as countries begin to emerge from lockdowns and reduce services for diseases other than COVID, cancer patients' rights are more important than ever. The European Code of Cancer Practice is a ready-made tool for everyone to support the attainment of these patients' rights. Cancer won't wait for the pandemic to end, and neither should we. It's definitely time to act. For more information on the European Code of Cancer Practice, visit europeancancer.org/code. Back to you, Matti.
Thank you very much, Kathy. Thank you for representing so well the European Code of Cancer Practice. This, if enforced in every country, will already make a difference. We don't need more money for this. We just need people to act on the science that is behind all of these requests from the patients. And it is now my pleasure to ask Andreas Haralambous, our president-elect, who is also the co-chair of our workforce network, to continue this time to act beginning of this campaign. Andreas, the floor is yours.
Thank you so much, Matti, and good afternoon, everyone. My name is Andreas Haralambous. I'm a professor of cancer nursing and palliative care at the Cyprus University of Technology and adjunct professor at the University of Turku in Finland. I'm the president-elect of the European Cancer Organization and co-chair of our workforce network. As Kathy presented just a few seconds ago, one fundamental right of the European Code of Cancer Practice is access to specialized multidisciplinary care. Beyond being a fundamental right of every person affected by cancer to have access to specialized multidisciplinary and multi-professional care, it is pivotal to ensure that this kind of care is delivered by specialized, competent, and resilient professionals. In achieving this, we need to make sure they have the right tools for the job at the right moment. The data from relevant studies on the impact of COVID-19 are devastating. For example, today's research reveals startling workforce impacts from COVID-19, including 4 in 10 healthcare workers feeling burnout and 3 in 10 showing signs of clinical depression. Furthermore, one of our recently completed international studies showed that the impact of COVID-19 on the oncology workforce is much more complex, which is evident in the fact that burnout can subsequently compromise their ability to cope with the situation and minimize their resilience over time. The European Cancer Organization, acknowledging the central place that the workforce holds in cancer care treatment, established the Workforce Network, comprising of 14 different societies, 3 patient organizations, as well as charities and foundations. And it is led by representatives of the European Society of Oncology, Pharmacy, the European Society of Surgical Oncology, as well as the European Oncology Nursing Society. In light of the EU Beating Cancer Plan implementation, the network works towards bringing forward a unique perspective and first-hand experience on the successful and sustainable implementation of the plan. In a more general context, echoing the long-standing challenges faced by the oncology workforce, some of which have been exacerbated by the current COVID-19 pandemic, developed the Workforce Network Consensus Paper, Working Against Cancer. The 4 key challenges as described and given policy focus include resolving the difficulties caused by workforce shortages, reducing unnecessary barriers to professional mobility, improving occupational conditions to protect the safety and well-being of healthcare professionals working in cancer care, and enhancing education and development opportunities for healthcare professionals that are now even more achievable in the digital age. The time to act is now. End workforce shortages. Make access to cancer professions a part of the Cancer Inequalities Registry. Initiate a cancer-related skills partnership under the EU Pact for Skills strategy. Make workforce capacity mapping and response part of the mandate of the new Health Emergency Response Authority, and initiate an EU study on pay, conditions, and career structure for workers in the cancer sector. The time to act is now to improve occupational safety and well-being. Our policy recommendations include mandate EU OSHA to focus on the occupational safety and health concerns of the cancer workforce as part of the EU's collective combat of cancer. In doing so, address exposures of healthcare workers to hazards in the workplace, such as cytotoxic substances. Use EU funding tools to promote safety culture and practices, and publish official EU guidance on ensuring the well-being of healthcare professionals. The time to act is now. Wait no longer. Thank you.
Thank you very much, Andreas. The work of the group that you co-chair is so important, and we really have to move in the right direction here. And now I already thanked the members of the Parliament for everything they do, and it's a pleasure to introduce three of them who have joined us: MEPs Alessandra Moretti, Sarah Cerdas, and Francis Fitzgerald, who are working within the Special Becker Committee, and that will tell us what they think is important in their view about the Time to Act campaign. And the first one I have here is Alessandra Moretti. Alessandra, per favore.
Thank you. Thank you, President Apro, and thank you to all the people who took part in this event today. It's time to act. It's very reassuring to see the support and the level of commitment of so many different stakeholders for this issue. It was said before, many lives are at risk if we don't act now. And I would like to thank the European Cancer Organization for this initiative. Of course, people were scared during this pandemic. It's understandable. Many of them are still scared today, but we need to reassure them that our health systems are now safe. They have adapted to the new situation and have implemented safety measures to protect everyone, in particular the most vulnerable. Today, it's safe to go to the doctor and to undergo screening, visits, and exams. Even more so, postponing screening, therapies, or simple visit to the doctor is a risk no one should take. We need to welcome back every citizen or patient into the prevention programs at every level. This is an issue where the EU can and should make the difference. Starting with communication campaigns targeting people at risk, but also by requiring member states to do their part. This is why I believe a genuine and effective EU health union should be created as soon as possible, with legislative and regulatory provisions setting up minimum standards for healthcare public services, also in terms of clear and mandatory objectives for screening and vaccinations. We experience too many discriminations around Europe, among member states, but also within the same country. Depending on where you live, you might have more or less chance to survive cancer due to the different efficiency of the healthcare systems. I want a Europe where every young kid has the same rights as any other. And I want both member states and you institutions to be accountable for this. This is why we demand a true and complete EU health union to guarantee same rights for every citizen and every patient. We need legislative measures, but we also need a stronger cooperation among all the different players, from public institutions to media outlets, networks, and associations of different forms working on this issue. As European Parliament, we have spent the last few months in the BECA committee, listening to the many voices of our report to adjust and propose changes to be the Beating Cancer Plan to improve it where needed. However, if we can take one lesson already from the many hearings and the work we have done so far in BECA, is that cancer is a very complicated and multi-phase challenge. Therefore, everyone can make a difference, and we will not succeed if we don't coordinate the efforts and work together in the same direction. I very much look forward to bring this campaign at the national level, and I'm sure we will be together in this in the next few weeks and months. Thank you very much.
Grazie mille. This was such a clear and powerful message. And now we go to Sarah Cherdas.
Thank you very much for giving me the floor. And I would like to thank the organization for such an important event and for this launch. We know that last year, I'm a medical doctor, and last year we responded to a very unknown health threat. And this virus is a true destroyer of health systems. So this made quite a hurricane in accessibility to healthcare. We know that as a matter of deal with the virus, the new virus, and with the precautionary principle, health services had to adapt and treat, and some services were even closed. A lot of surgical services, ambulatory access, all these services were closed because of the precautionary principle, because we were dealing with an unknown threat. But 1 year later, what do we know? We know much more about SARS-CoV-2, which is the virus. We know how the infection works. We still don't know some of the details, but we know on the overall. And we know how to control the dissemination of disease. And today, this to say that today healthcare services are much more prepared to receive patients and to work with communities in order to improve health outcomes from prevention to treatment and quality of life. We are very much aware of the impact that COVID-19 had in undiagnosed cases and delay of treatment. For instance, we know now that about 1 million of cancer cases could have been undiagnosed, as 100 million screening tests were not performed during this pandemic. And now it's the time to act. We must not return to normality. We must return to a new normality where we can deliver a better health services. We need a greater effort to recover from last year and go a step forward in the fight against cancer. We need to restore the confidence of citizens, patients in healthcare services, in cancer healthcare services. We need to invest in immunization against diseases such as HPV and hepatitis B. We need to embrace this momentum that we are having at the European level to discuss cancer, to increase accessibility to medicines and new therapeutics through the European Pharma Strategy and the European Beating Cancer Plan. We are in this incredible moment, but we also have some other tools that we can learn from. The European Health Data Space, which can create vast repositories of data that in this regard will be transformed into information, and this information will lead for better evidence. The European Health Union, as my colleague Alessandra has talked about, will bring more availability of medical devices and equipment. We must also invest in research and conduction of scientific research for new therapeutics, new medical tools, but to also invest in research in strong, robust cohort studies so we can have better epidemiological evidence. And for this, we have so many steps to give, but we must above all work together with the stakeholders to improve the approach to cancer patients, ensure sharing of good practices, and create new guidelines on cancer practices. We need to increase the health services resilience and prepare the health services to continue the care of main diseases when a health threat is ongoing. Today is COVID-19, tomorrow is antimicrobial resistance, the day after is climate change. We're going to be going through several crises in the coming days, and we must not delay cancer treatment, cancer accessibility. The time to act is now. Thank you very much for giving me the floor.
Muito obrigado, Sarah Cerdas. This was, again, such a powerful message. It's wonderful to have these members of the parliament talking to us. And last but not least, I'm calling on Frances Fitzgerald.
Thank you very much indeed. Good morning, everyone. I hope you can see and hear me okay. I'm delighted to be speaking here this morning with my colleagues from the Parliament. This is a time of challenge in relation to cancer and cancer services and patients with cancer, for patients with cancer. It's also a time, as you've heard from my colleagues, it's also a time of opportunity across the European institutions. And what we have to do is to make the very most of that, so we end up giving a far better service to our individual citizens across all of the member states. I believe we can do this, and the potential is enormous. We need multi-stake partnerships, stakeholder partnerships. We need to work cross disciplines. It needs to be multidisciplinary. We need NGOs, governments, cancer organizations, researchers, and doctors working together. That's the model we have to follow. So well done on this timely event. It's great to see the European Cancer Organization highlighting and stressing that it's time to act. And as chair of the Transforming Breast Cancer Together initiative, and as the EPP coordinator on the FAM committee, I am only too well aware of the silent killer that is going unmonitored, as you have said, amongst us during the COVID-19 pandemic. We have seen screening services paused, and we saw where the immediate threat to hospitals was so high, they were overwhelmed, and people were very fearful of coming forward. And of course, that still remains for many, so we have to act. The Transforming Breast Cancer Initiative highlighted the urgency of this situation over the past number of months. And in March, we did an event. You may not die from COVID-19, but if cancer is left untreated, you're not likely to survive. And that really sums up the urgency of the situation. In January, the Parliament adopted a report I was responsible for, which was the gender perspective of the COVID-19 crisis and post-crisis period, because of course COVID impacts differentially on women and men. And in that report, we made the point on the member states to ensure that essential non-COVID related healthcare, such as cancer care, was accessible throughout the pandemic and similar emergency situations. We must learn from what has happened in this past year and build more resilient and robust healthcare systems. We have seen good best practice examples really from different institutions who have worked on the issue, providing dedicated cancer pathways that are entirely separate from where patients are being treated for COVID-19. This has been an important response and very crucial. So I think we need to draw up best practice from across Europe to make sure this is being followed every place, even as we continue to deal with the COVID crisis. So, we have to give the message, as you have said, to individuals. If you have symptoms, go and see your doctor. Go for your routine screening if you are called, because hospitals are safe, and governments don't make the same mistake twice. We know now we have a huge backlog of cases, not only to diagnose and treat, but to discover. I conclude by saying, as my colleagues have said, the potential at European level is enormous in terms of bringing together best thinking to ensure we have the kind of innovation promoted that is needed, that we share access to innovative drugs, innovative devices, and above all, that we try and get equity into the system of access for cancer treatment across Europe, because it is still grossly inequitable. And we can and act. We've shown how we can do it on COVID, a shaky start, but we've got there. We need to bring together these concrete actions to ensure across Europe we are working more comprehensively and coherently on the best possible care for our cancer patients. Thank you for all you were doing. Thank you to the NGOs, the doctors, the researchers. It's about making sure that there is coordination at European level to take away any barriers that are there at the moment in terms of that equity. Thank you very much indeed.
Thank you very much, Frances, and all the members of the European Parliament that were with us. With your support, all together, we can do something. And we can do it in such a diverse Europe where we speak so many languages. And we are using here English, but we could be using many other languages. So let's listen to testimonials in various languages about the fact that it is time to act.
It's time to act.
Don't let COVID-19
stop you
from tackling cancer.
Älä anna koronan estää syöpäseulontaa.
No dejes que el COVID te impida hacer frente al cáncer.
Il Covid non deve fermare la lotta contro il cancro.
Não deixe que a Covid-19 o impeça de enfrentar o cancro.
Ne engedje, hogy a Covid megakadályozza a rák elleni küzdelemben.
Не позволявайте на COVID-19 да възпрепятства борбата с рак.
La Covid-19 ne doit pas être un frein aux soins contre le cancer.
Laat COVID-19 u er niet van weerhouden kanker aan te.
Laikas veikti. Neleiskime COVID-19 stabdyti mūsų kovos su vėžiu.
Nu lăsați COVID-19 să vă împiedice în combaterea cancerului.
Μην αφήσεις την COVID-19 να σε σταματήσει από την αντιμετώπιση του καρκίνου.
Ne dopustite da vas COVID-19 spriječi u borbi protiv raka.
Covid-19 darf der Behandlung von Krebs nicht im Wege stehen.
Laat COVID-19 u er niet van weerhouden kanker aan te pakken.
Time to act.
It's time to act.
It is time to act.
Don't let COVID-19 stop you from tackling cancer.
We can all make it a success and call time on cancer. It's time to act. For all of us, to act together. To find out how, go to timetoactcancer.com. Thank you.
It is time to act. And some of you can read behind me. Il Covid non deve fermare la lotta contro il cancro. Why I'm saying this in Italian? Because it's my pleasure now to introduce Sandra Gallina, Director General of DG Santé, who is from Italy. And I have the pleasure of sometimes speaking Italian with her. Sandra, tell us, what are your thoughts about the Time to Act campaign?
Thank you.
speak with him. I wish I could articulate a few words in Finnish like he speaks Italian. Now, I have been listening attentively to the exchanges, and I must say that it's a real pleasure and an honor to be here because it's time to act. And I fully support your campaign. I would like to say, how could I do otherwise? Because you know that it is one of the real most strongly felt priorities of my commissioner, also for her past, for her real, I would say, sufferings, but I would say it's because cancer is a serious issue. And I also like the idea that we are not in a competition, we are not competing with other diseases. This is the cancer organization, this is the cancer, I would say, forum, and we're talking about cancer, but we know that COVID took a very big toll on many, many diseases. So I would like to say that we're definitely ready to help with the Europe's Beating Cancer plan. Substantial funding is there. The funding needs to be used. So please help us use the funding. The EU for Health program has, I would say, a dedicated section, or at least we are trying to really put cancer at the forefront of most of the funds that we will be allocating, because we would like to have a more robust health system to deal with the, I would say, with the suffering that is caused by cancer, because we should not forget the very bad aspect of the impairments of the lives of cancer patients. So I have heard it here, and it has been repeated, governments and public health authorities play a vital role, but of course, you know, they have, I would say, many issues, many priorities, many economic challenges. So this is why it's very important that we have also this European dimension to help the governments. The stakeholder contact group set up under the Commission's health policy platform is the place where we can discuss with stakeholders who wish to be involved in the implementation of the cancer plan and the monitoring of its actions. And I hope there will be many, because really we need you. As I said, the devastating impact of COVID on cancer care services, and I would say on other aspects that concern the life of cancer patients, you know, is really there, and it's not just a topic of discussion. We need to act. I may say that Honorable Fitzgerald said that there is a silent issue of the deaths concerning cancer. Well, it's not so silent, because we have been taking numbers and we have been seeing that, you know, in some cases, cancer has been completely forgotten because of the pandemic that has hit us. So despite this current difficult circumstances, I think we should be encouraging citizens not to postpone their checkups or their treatments for cancer. This is, I would say, basic, and it's the first port of call, but it's a message that should come out very strongly from this event. We should also ensure that the people feel secure when they go to seek advice and to seek, I would say, and to have the screening. So I would like to say that this is important, because it's important to detect cancer at the earliest possible stage. And if I were to say, that is really the best important moment to beat cancer altogether. So this is why we, as Europe Beating Cancer Plan supporters, we would like to put the patient at the center of this strategy. So I must say that I have been listening to all your voices, to all your insights, and I must say that the ECCO partnership is vital for us. It's vital because the cancer plan can only be as good as you will make it during the implementation with your support. So from me, a big thank you to you all for all the help that you will give us to implement this big monumental program.
Grazie mille, Sandra. And in Finnish, paljon kiitoksia. And to all of you that have been with us, 1,000 thanks. Your support is going to be very important. And in your countries, please help us. In the countries where we'll have the launches, the first one is going to be in Poland on May 22nd. And we thank, of course, Bartos for helping us there. And we will continue in Italy, in Romania, in Spain, and other countries will follow. Those of you who want to help us, please contact us. You have this here on the slide. Thank you very much. It is time to act.